Because of the proposed 21% Medicare cuts, some doctors have been forced to stop seeing senior patients with Medicare. At Tulsa Pain Consultants, they don't believe in turning their backs on their seniors. Dr. Andrew Revelis is here this morning to explain why. Good to see you, sir.
Good to be back.
Okay, let's start from the beginning. What exactly do you all do as a pain management physician? What does that mean?
Well, I mean, we're medical doctors. We manage chronic pain and pain-related disorders, and our main goal is to treat people's pain, evaluate it first, find out what the cause is, but many times treat it in a non-surgical and as much as we can in a non-medication related way.
Okay.
So our goal is to get to the bottom of what's going on and manage their pain. If people are hurting, they don't have to, and it doesn't always necessarily mean you need to have surgery. There are many ways to manage this pain in a non-surgical way.
Okay, so that's great relief. So if I was to come and see you, say I've had back pain forever, I've been to all types of different places, I just can't get it fixed. What happens once I go and see you?
Well, I mean, we're going to get records from your primary care doctor. We're going to see what kind of tests you've had done thus far. Do you need another MRI? Do you need some other medical testing that'll better allow us to hone in on what the source of your pain is? At that point, once we've decided what's going on, we're going to kind of individualize your treatment plan to deal with a problem and try to effectively control your pain and get you back to work or back to a functional status. With some of our elderly population, they may not be working, but you want them to enjoy their day-to-day activities and have a quality of life, and that's the important thing. Just because you're hurting, it doesn't mean you have to be relegated to the side and suffer in pain unnecessarily.
And a good quality of life does not exist if you're in pain, because it just makes everything bad.
That is true.
Okay, I've heard great things about injectables. What different types do you do?
Well, I mean, the main focus of what we do, when you have a herniated disc, it's pushing on a nerve, the non-surgical way of managing it is to do X-ray guided injections where we can put some cortisone type medication right on that nerve, right where the disc is involved, and relieve some of that pressure that's on the nerves and treat your problem. Because a lot of times it doesn't necessarily have to result in surgery. You don't necessarily have to have surgery if you're having these issues. It can be treated in a simple way with these little injections. We can give you happy medicine, I call it, through the IV, so that you don't even remember having the procedure done. And it's a quick and easy outpatient procedure you can have done that's covered by all major insurance and Medicare.
Speaking of Medicare, what is the latest on what's going on in Congress?
Well, what's going on is as physicians, we feel like we're caught in the middle of this debate. There's a proposed 21% Medicare cut, and a lot of physicians are choosing to drop Medicare altogether and not see seniors who carry Medicare. We come from the community. I grew up here in Tulsa. We see lots of seniors. I see lots of seniors out at the grocery store or at Home Depot or at Lowe's, and we can't turn our back on these seniors. Regardless of what happens with the cuts, I'm about treating the patient. I'm not the bill collector at our office. I have people that deal with that. So my focus is on the patient, and we will continue to see patients regardless of their payer. And if Medicare cuts, then we're going to continue to see seniors. But we're hoping that people in Washington can come up with a reasonable equation to pay us and not do such a drastic cut. But in any event, we have no plans on dropping seniors because we're committed to the seniors in our community.
Good to hear. Dr. Revelis, thank you so much for coming in. And thank you for the update. We appreciate it. I know a lot of your patients who've come to see you are very concerned about it, so it's good to hear. The Tulsa Pain Consultants are located at 2000 South Wheeling Avenue, Suite 600. Call 742-7030. Go online, tulsapain.com.